Black men who sleep with other men, at current rates, 1 in every 2 will be diagnosed with HIV sometime in their lifetime.
That's the reality of HIV in America today. A staggering number of Black and Latino men who have sex with other men are at risk of contracting the disease. The good news is that stopping the transmission of HIV in the United States is an achievable goal, and it's one the Trump administration has pledged to accomplish with a new initiative. I sat down with Lenny Bernstein, a health and medicine reporter for the Washington Post, who's been following this story.
There's roughly 39,000 new HIV diagnoses in America each year, and that has been almost completely stable for the past 4 or 5 years, which means we've sort of plateaued in our progress against the disease.
What is the best way to prevent new infection?
We have this marvelous drug, PrEP, stands for pre-exposure prophylaxis. It's a single pill. You take it every day, and as long as you stay on it, you can cut your risk of becoming infected through sex by well over 90%, and you can cut your risk of becoming infected through intravenous drug use by well over 70%.
The problem is access. Many of the HIV hotspots in the US are in the rural South, where there's little access to healthcare. And PrEP is expensive, around $1,600 a month, and it's not universally covered by insurance. The company that makes the drug does offer a program for poor, at-risk people to get it, but there are other issues.
In many places in the United States, people are not on PrEP. A lot of doctors have not even heard of PrEP. A lot of places don't stock PrEP.
There may also be some stigma, including racial bias, around admitting you have gay sex.
If you combine that with living in a small town, in a rural area, where, let's say, it's quite easy for people to know your business, and you go in to either get or fill a prescription for PrEP and you don't want people to know that you're on it, you may very well be dealing with somebody you know.
And then there's just the reality of being poor or homeless.
I mean, imagine if your life is so disorganized and chaotic and turbulent that, you're not quite sure where you're going to sleep tonight. Are you going to be able to take a pill every day and, stay on that? Oh yeah, it's time for me to take it's not going to happen.
Today, your risk of getting HIV is determined in part by geography. In 2017, 52% of new diagnoses were made in the South. So the Trump administration plans to target its new initiative towards 7 southern states. It will also focus on 48 counties across the US that are HIV hotspots, plus Puerto Rico and Washington, D.C., which has the highest rate of transmission in the country. Here's the government's plan for ending the disease. First, diagnose people with HIV as early as possible. Second, get people who are infected on antiretroviral therapy. With effective medication, you can drop your viral load to the point where you could have unprotected sex and not transmit the disease. Third, get people who are at risk of contracting the virus on PrEP. And fourth, monitor where in the country HIV is spreading most rapidly, educate people about the medications, and make sure those who most need care have access to it.
They just started. They just put $290 million into the upcoming budget. That's a drop in the bucket. It's the first step.
What do you think the barriers are to this plan working?
Well, it's going to cost a lot of money. That's the big thing. It will cost billions and billions. Also, the same administration that wants to wipe out HIV is cutting back on Medicaid and other government programs that provide health care. So you can't give with one hand and take away with the other. Let's say you're on Medicaid and I wipe out your ability to find a doctor in your little town in the middle of nowhere. Well, then how are you ever going to hear about PrEP?
The Trump administration has pledged to reduce transmission by 75% in the next 5 years and 90% by 2030. It's an ambitious goal, but with enough money and healthcare programs, it is possible.